Meet Alex. 43, decides today is the day he's finally going to pressure wash the back steps. Steps are wet. Down he goes, smacks the back of his head, and this is the part that matters, pops right back up like nothing happened. No blackout, no goose egg the size of a golf ball, just a little ow, and back to the pressure washer. 20 minutes later, Alex has a headache, the yard looks a little tilted, and he can't quite remember which step he actually slipped on. Alex thinks he's fine because he never passed out. That right there, that's one of the biggest myths about concussions, and it trips up more people than you'd think. In the next few minutes, I'm going to talk about what's actually happening inside your head during a concussion, the symptoms that people brush off way too easily, when a bump on the head actually needs a trip to the emergency department, and what actually happens once you show up. And here's a twist for you. There's a test almost every single patient assumes we're going to order, and it usually can't tell us whether you actually have a concussion at all. I'm not explaining that one yet, you're going to have to stick around for it. Quick note before we dive in, I'm a board-certified emergency medicine physician, and this channel is all about translating what I see every day in the ER into plain English. No jargon, just the stuff you actually need to know. If that sounds like something you'd find helpful, please like this video and subscribe. All right, back to Alex. A mild concussion is a type of mild traumatic brain injury, and I want to pause on that word mild because it causes a lot of confusion. Mild is a medical severity category, not a review of how much your symptoms are going to bother you. Plenty of people with a mild TBI, that's traumatic brain injury, feel like absolute garbage for days. Here's the simplest way to picture it. Your brain is basically a soft, delicate structure floating in fluid, sitting inside a hard protective shell, your skull. It's a great system for everyday life, but it was not designed for sudden stops. When your head takes a hit or even whips around fast enough, think whiplash from a car accident or a hard tackle, your brain can shift and twist inside that shell faster than it's built to handle. It's like your brain slamming the brakes half a second after your skull already did. That sudden movement temporarily scrambles how your brain cells are communicating with each other. Nothing's broken, nothing's bleeding. It's more like your brain's Wi-Fi router just got knocked off the shelf. Everything's still there, it's just not talking to everything else properly for a while. Remember, Alex never lost consciousness, not for a second, and that trips people up constantly. Concussion symptoms can show up immediately, or they can take hours, sometimes even a day or two, to fully appear, and losing consciousness is not required for the diagnosis. In fact, most people with concussions never black out at all. So if you've ever hit your head, felt fine, and then quietly wondered later why you couldn't remember your drive home, that's not nothing. Instead of throwing a giant checklist at you, let's group it into 3 buckets. Physically, you might have a headache, dizziness, nausea, trouble with balance, or your eyes suddenly deciding sunlight is the enemy. On the thinking side, people describe feeling foggy, like they're trying to think through a pool of syrup, plus trouble concentrating or holding on to short-term memories. And emotionally, you might feel unusually irritable, weirdly weepy over nothing, or you're sleeping way more or way less than normal. Here's where the stakes go up a notch. The real question after a head injury usually isn't, is this a concussion? It's, is there something more dangerous going on inside that skull? Because a concussion and something like bleeding around the brain can look confusingly similar at first. So how do we actually tell the difference? Remember that test I mentioned earlier, the one almost everyone assumes will settle the question? It's the CAT scan. And here's the twist. A normal CT scan does not mean you don't have a concussion. I know, that sounds backwards, but in the emergency department, a concussion is what's called a clinical diagnosis, meaning we diagnose it based on how the injury happened, what symptoms you're having, and what we find on your exam, not by spotting it on a scan. A CT scan is looking for something else entirely: bleeding, a skull fracture, swelling of the brain, the more dangerous stuff. It's not designed to see a concussion because a concussion is a change in how your brain is functioning, not a visible injury on a scan. So yes, you can walk out of the emergency department with a perfectly clean CT scan and a very real concussion. Both things can be true at once. Now, most concussions are not life-threatening, and most people are going to be fine. But certain symptoms after a head injury are your cue to stop waiting it out and go straight to the emergency department. These danger signs include a headache that keeps getting worse and won't let up, repeated vomiting, a seizure or convulsion, increased confusion, agitation, or unusual behavior, weakness, numbness, slurred speech, or trouble with coordination, one pupil looking noticeably larger than the other, getting drowsier and drowsier, or trouble staying awake. If you or someone you're with checks any of those boxes after hitting their head, it's not a wait and see how tomorrow goes situation. It's a go now situation. So back to Alex. His symptoms aren't improving and his family decides enough is enough. They bring him in. Here's what an emergency department visit for a head injury actually looks like. We're going to ask how the injury happened, whether you lost consciousness, whether you're on blood thinners, whether you remember the event clearly, whether you've been vomiting, and how your symptoms have changed since it happened. Then we'll do a hands-on exam, checking your mental status, your pupils, your strength, your sensation, your coordination, and your balance. And here's the other piece of that CAT scan puzzle. Not everyone with a suspected concussion actually needs a CT scan. We use the story, the exam, and specific risk factors like your age, whether you're on blood thinners, or specific patterns of memory loss to decide who actually needs imaging and who doesn't. It's not a reflex test we order on autopilot. The good news is that most people gradually get better after a concussion, often within a couple of weeks, though recovery timelines vary person to person. And the advice has actually changed here. We used to tell people to go lock themselves in a dark room and do absolutely nothing for days. Current guidelines say that's not the move anymore. Instead, we recommend a short period of relative rest, followed by a gradual return to your normal activities as you're able to tolerate them, easing off on anything that clearly makes symptoms worse, which includes limiting screen time. We recommend you use Tylenol for headaches or pain and avoid ibuprofen or aspirin during the first 24 to 48 hours. Finally, make sure to get medical clearance from your PCP or a neurologist before heading back to sports or anything with a real risk of hitting your head again. That last part matters a lot. Taking another hit before you've fully recovered from the first concussion can be genuinely dangerous. So what happened to Alex? His CT scan came back completely normal, no bleeding, nothing scary lurking in there. But his symptoms and his exam still added up to a clear concussion. Normal scan, real concussion. Both things true at the same time. Quick recap. 1. You don't have to lose consciousness to have a concussion. 2. Symptoms can show up right away or hours to days later. 3. A headache that's getting worse, repeated vomiting, confusion, seizures, or unusual neurologic changes after a head injury need urgent evaluation. And 4. A normal CT scan does not rule out a concussion. It's ruling out something else. Before watching this, did you think you had to get knocked out cold to have a concussion? Tell me in the comments. I'm curious how common that assumption actually is. If this video helped you understand something you didn't before, drop a comment below. I genuinely read them. And if you want more plain English emergency medicine content, don't forget to like and subscribe. As always, stay prepared, not scared.